Courage is contagious, and we want to see it spread like wildfire throughout our nation. Welcome to the Gold Report, where we hope to inspire you to be 10% more courageous in your own life. I'm so glad you're here. Please like, share, and subscribe so you never miss an episode. Our guest today is passionate about health and has been on a quest to educate and help others in the medical field. We'll be right back to introduce him. Gold Care is the replacement for the current healthcare system. How does it work? First, you join our Gold Care Association, which keeps the government out of your business. Then you can schedule with a provider of your choice and meet through our proprietary telehealth platform. We work to get you well and off prescription medication. All costs are upfront and transparent, as it should be. Do something for yourself and your family, and put a doctor in your pocket. We're ready for you. Dr. Norman Ruiz-Castaneda was born and raised in Miami, Florida by Cuban parents who instilled a love of family, faith, and food. Dr. Norman Ruiz-Castaneda received his doctorate of pharmacy, PharmD, from the University of Florida College of Pharmacy. He's a licensed pharmacist in the states of Florida, Michigan, and Virginia. Dr. Norman's dreams of opening his own pharmacy and bringing back value-based patient care to the profession became a reality in 2020. During the pandemic and uncharted challenges, both Norman and his wife, Christy, set out to conceptualize, design, and build out North Naples' first USP 800 compliant compounding laboratories and bring back the nostalgic design of a hometown pharmacy with a modern twist. Welcome to Uptown Chemist. I'm happy to welcome to the show today, Dr. Norman. So glad you're here.
Hey, Dr. Gold, how are you?
Great.
Pleasure to be here.
Yeah, well, I moved to Naples because it is like the epicenter of the freedom movement, really.
Yeah, paradise. And you got plenty of the Florida freedoms, and what beautiful place to be and live in Naples, Florida, right?
Yeah. So everybody knows, I became known, I suppose, in 2020, which is a big transition year for a lot of us, and started kind of fighting for patient rights and physician rights, et cetera. And, I'm a lawyer as well. And one of the things I saw first in 2020 was the unprecedented power grab by people who shouldn't take power, like things that are actually written into law was not being followed. Specifically, the governor of the state I was living in, California, sent all prescribers a memo saying that if we prescribed hydroxychloroquine for COVID, we could lose our license.
Yeah.
It was incredible. So many states did that. Some states didn't. Florida did not.
Right.
But that was shocking to me as a lawyer because hydroxychloroquine was an FDA-approved medication for 65 years at that point, and never did the government interfere and say you can prescribe it for this or not this. In other words, it wasn't trying to pull it off the market. It knew it was too safe for that.
Right.
But it was saying you couldn't prescribe it for this. So my first question for you is, have you ever seen anything like this in your career?
No, that was actually probably the first time that I'd ever seen anything like that. The fact that there was governors or, the government stepping in and regulating how a physician would prescribe. A lot of medications are FDA approved for certain indications, but the physician actually has the authority to prescribe off-label. That's the majority of medications, prescriptions can be prescribed off-label, and using, a specific medication that has proven safety profile, just like hydroxychloroquine, and limiting the access, it's just one of those things that was never seen done before.
Right. And I had never seen it. And so I was looking at this as, as an ER doctor, I'm frontline with the patients, and I was upset maybe the patients couldn't get what they needed, but I was equally upset as a lawyer that who is the governor's agency bureaucrat there to tell me, a physician, I went to medical school, residency, had lots of experience, take lots of exams. And so we had some bureaucrats saying, I can use it for this, but not for this.
Right.
It was unbelievable. And I didn't understand how come physicians weren't mad that their professional rights were being imposed upon.
Yeah, that was pretty incredible. The fact that the government was limiting your prescribing ability. What medical training does the government have?
It was craziness.
Pretty much none, right? They kind of have, doctors that are in government, but it's not like those doctors are really practicing.
Right.
So, it was just out of this world crazy.
You're listening to The Gold Report with Dr. Simone Gold. To watch this week's full episode of The Gold Report, please visit www.thegoldreport.com.